Panama healthcare can be excellent, but only if you understand the system, your location, your insurance, and what to prepare before you need care.
This Panama Healthcare series shows you how to plan for care, from insurance and emergencies to hospitals, pharmacies, and chronic conditions.
Welcome to The Explainer. If you're an expat, a digital nomad, or maybe you're a retiree planning your big move, you've probably spent countless hours dreaming about Panama. You know, the pristine beaches, the vibrant culture, that incredible climate. But today, we're talking about something far more critical to your actual success abroad. We are setting the stage to completely demystify Panama's healthcare landscape. My goal here is simple: to arm you with the exact knowledge you need to navigate this system smoothly and, most importantly, with absolute confidence.
It's a pretty simple question, right? What actually happens if you get sick in Panama? But it's also a highly provocative one because it challenges a very common misconception. A lot of folks moving to Latin America just assume that healthcare abroad is uniformly cheap, incredibly easy, and always accessible. But the reality? Finding the right care requires strategic, intentional preparation. You really have to ask yourself, where would I go? How would I communicate? And maybe most crucially, how would I pay for it?
Consider this rather impressive number: 79.8 years. According to the Pan American Health Organization, or PAHO, that is the average life expectancy down in Panama. The World Health Organization even lists Panama as a high-income country with really strong health expenditure indicators, so the country definitely has a robust medical foundation. But here's the catch: those fantastic national averages absolutely do not negate the need for a personal plan. A high national life expectancy is great, but it's not going to tell you which clinic to visit in a rural mountain town during a crisis.
Okay, let's dive into our roadmap for today's explainer. We're going to cover 1. The system, 2. Geography, 3. Costs and realities, and finally, 4. The starter kit. Section 1. The system, MINSA, CSS, and private healthcare. Panama's healthcare isn't just one giant monolith. It's a blended mix of 3 totally distinct pillars. The first pillar is MINSA. This is Panama's Ministry of Health. Basically, they're the central government authority that handles public health information, sets regulations, and runs a huge network of public sector facilities. For newcomers, wrapping your head around MINSA is absolutely crucial. They are your primary source for official health guidance, local vaccination campaigns, and the public clinics known as Centros de Salud. You might very well need to rely on them, especially if you have a rural emergency. The second pillar is the CSS, the Caja de Seguro Social. Now you have to contrast this with MINSA. CSS is Panama's social security institution, and it's built entirely on principles of solidarity and equity. It strictly serves insured users, who are referred to locally as asegurados. The CSS operates its own entirely separate network of hospitals and regional clinics called policlínicas. What this means for you, practically speaking, is that not every public facility operates by the same rules. You literally can't just walk into a CSS facility and expect it to function exactly like a MINSA clinic if you aren't already plugged into the social security system.
And that brings us to the third pillar, private care. For most foreigners, your healthcare strategy is going to be a blended approach. Private care is super attractive because it generally offers speed, really comfortable facilities, and English support for routine specialist visits or elective procedures. However, public care remains absolutely essential. You might need it for a rapid emergency response, local health campaigns, or simply because a public MINSA facility just happens to be the closest option to your remote beach house.
Which leads directly to a harsh but pragmatic reality check. In an emergency, the best facility may simply be the closest facility that can stabilize you, not that fancy private clinic you researched for routine care. Emergency decision trees are a completely different beast from routine visits. If you suffer a serious injury, stabilization is the only priority. In fact, the UK's Foreign, Commonwealth and Development Office advises calling for an ambulance immediately and contacting your insurance because, let's face it, emergency routing doesn't care about the waiting room's decor. Let's move to Section 2 and see how this builds. Geography determines your care. Location is everything. The World Bank specifically points out some massive regional disparities in Panama's healthcare access. In Panama City, you're in the strongest hub for advanced private hospitals and English-speaking staff. Heading west, David and Chiriquí acts as a vital regional anchor. Having places like the Policlínica de David means you aren't medically isolated if you live up in the nearby mountains.
The Pacific Beach Corridor? That's a great convenient zone for minor issues. But remember, a beach clinic is not a capital city hospital. And finally, if you choose remote spots like Bocas del Toro or Pedesi, you are taking on the full responsibility of heavy emergency planning and transport routes.
We really have to ground that abstract geography into concrete, everyday scenarios. Because in Panama, distance isn't just measured in miles. It's measured by environmental realities. A heavy rainstorm, steep mountain roads, a missed island ferry schedule, or driving at night can entirely rewrite your emergency plan. A clinic might theoretically just be 20 miles away, but if the road washes out, your healthcare access suddenly drops to zero unless you plan for alternate transport.
Moving on to Section 3, Costs, Language, and Realities, the friction points.
Now, what's really interesting here is a specific, highly revealing metric from PAHO, 37.33%. That represents the percentage of total health expenditure in Panama that is paid entirely out of pocket. As a foreigner, you absolutely must plan for this upfront payment friction. You can't just flash a foreign insurance card and assume the doors are going to swing wide open for you.
Let's explore those real-world friction points. Private hospitals very often require upfront deposits before any non-emergency treatment, and even if you have phenomenal international insurance, you might face significant reimbursement delays, meaning you pay first and claim later. You have to watch out for hidden fees too. A quoted doctor's visit fee might not include the labs, the imaging, or the rural transport to even get there. And perhaps most importantly, direct billing is never guaranteed. You always have to ask the right questions beforehand.
Language introduces another massive friction point. The big myth out there is that every doctor and hospital will have English-speaking staff. But the reality, backed heavily by travel health experts, is that Spanish is the official language. Sure, you might find English speakers in a private Panama City hospital, but out in the provinces, Spanish is an absolute requirement for triage, for signing consent forms, understanding pharmacy instructions, and getting registered.
Which brings us to our final part, Section 4, the Starter Kit. Prepare before you need care.
So the crucial takeaway is this actionable 4-step checklist. Step 1, create a 1-page medical summary. List your allergies, your meds, and your surgical history in both English and Spanish, and keep a copy in your wallet. Step 2, save your emergency numbers based on your specific destination. Step 3, identify at least one public MINSA option and one private option near where you'll be sleeping. And Step 4, call your insurer right now and explicitly confirm their direct billing rules and required documents for Panama.
Speaking of emergency numbers, you should save these right now. Organizations like the Smithsonian Tropical Research Institute and the UK government highlight these exact contacts. 911 is for general emergencies. 103 gets you the ambulance or fire department, and 104 is for the police. But don't just stop at the national numbers. You need the direct local line to the nearest private clinic and the nearest public MINSA facility in your specific town. To conquer that language barrier we talked about, prepare a basic Spanish emergency phrase sheet. We're talking simple phrases like, I have chest pain, I am allergic to, or I need an ambulance. Simple Spanish, delivered clearly under pressure, is infinitely more useful than trying to remember perfect grammar while you're in pain. And hey, if you're going in for a serious diagnosis or complex paperwork, definitely bring a bilingual friend or a patient coordinator to advocate for you.
All of this brings us to the absolute core theme for today. Waiting is the most expensive mistake. You literally cannot wait until you are sick, stressed, in pain, or trying to navigate a second language to figure this whole system out. Health professionals highly advise setting up your plan weeks before you even travel.
Which leaves us with one final critical thought. Have you built your Panama healthcare plan yet? The resources are absolutely out there. From insurance matrices to destination-specific hospital routing guides, the system is entirely manageable, but it heavily rewards those who prepare. Take the insights from this explainer, sit down today, and build your starter kit. You'll enjoy the beauty of Panama so much more knowing exactly what to do if things don't go according to plan. Thanks for learning with me today, and get to planning.
Join IGO Panama, the largest community for tourists and expats in Panama, and get free access to trusted resources, our private Facebook group, and our verified directory.
This 8-part Panama healthcare series helps expats plan for care, from insurance and emergencies to hospitals, pharmacies, chronic conditions, and what to avoid before you need care.
If you found this helpful, explore more on IGO Panama. Visit and join www.igopanama.com/join.